Yeah. Yes. Yeah. Yes. Yes. Richard Obeng. You can start
Hello,
now.
Hello, Mr. Christopher. Is Mr. Christopher, is that right?
Yes, of course. You're absolutely right, nurse.
Mr. Christopher, I am Richard, a nurse in a casualty ward. I'm going to be checking up on you today to make sure you are okay. Is that okay with you?
Actually, nurse, I am anxious and upset.
Well, I understand your feeling in case someone experience accidents as you are currently in this mood. But don't worry, you are in a competent nursing team and we are going to do our best for you. Is that okay with you?
Blood test. Oh, what's the reason? Why is it necessary?
Well, it is vital for us to do blood transfusion for you as you need it now. You know, you lost much blood during the accident, so it's vital for you to take this blood. Is that okay with you?
Yeah, but I am not sure. I'm not sure. I am not seriously injured. I know I have lost blood, and yeah, I was told that I need a blood transfusion, but I have no idea what the procedure will involve. I'm anxious about the procedure, and I am afraid. Okay, I'm afraid the danger of receiving infected blood. What if that blood is contaminated or infectious or dangerous for me?
Yes, I understand your feeling that you'll be quite anxious about this. Well, with this blood transfusion, the possibility of infection is quite minimal. As you are going to screen the blood, both the donor and also you as well, to know the blood is suit you. That's what I will say for you to understand. So the possibility for infection is quite minimal, and it's not going to affect you much more than you need the blood as well. So is that okay with you?
I have actually read in the newspapers and watched in the television that patients have contracted HIV and other contagious diseases through blood transfusions. And actually, I'm not interested in that kind of things.
Well, I understand your feeling, and this happens when uh, there is a kind of there is a kind of uh, maybe there was no screening in others, which it can be possible. However, I'm going to screen the blood. We are going to screen the blood to donate to you, as I said earlier on. So this blood transfusion is a sterile procedure, which you need not to worry about the maximum infection. Although during the procedure, it's likely to acquire infection. So I'm going to explain the procedure to you for you to know how this is done. Is that okay with you?
Um, I am unable to come out of my fear, but because you are telling, okay, give me an explanation about the
Yeah.
procedure. I want to know everything.
Okay. Yeah, that's fine. And you're supposed to know the procedure. So that's why I'm here to tell you everything. And this procedure is sterile procedure, and we are going to take every new thing to do it for you. It requires the syringe, new syringe, and we are going to watch you closely for any adverse reaction. I mean, for any negativity that will pops up. So we are going to monitor you from the beginning and after the transfusion. Is that okay with you?
What about the risks involved? Can you assure that I'm not going to face a hazardous situation in the future? Problematic situation. I don't want. Later, I should not regret of taking this.
Well, I understand your feeling and I get you. There is no future uh, complications as it is being used on another patient, and there has been a blood transfusion. Not only you are not going to be the first time, it's a normal thing that we do here. And I understand how anxious you are, and I can see from your face. So it's nothing to be worried about. You need this transfusion as soon as possible because you lost blood, which you are going to need to replace it. Is that okay with you, Mr. Christopher?
That's of course okay, but I want to be assured that I am not going to put myself into a difficult situation. So, how can I be sure that the blood I am receiving is not contagious or contaminated or harmful for my body? How can
Mr.
I get that assurance? There
Mr.
are chances, you said, but how I am away from those chances?
Mr. Christopher, I understand you. Your blood group is A positive, and we have the same A positive for you as well. So there's not going to be mismatch. And we've screened this blood and it's best fit you. And also, it's a sterile procedure, as I said earlier. We are going to watch you closely. Moreover, there's not going to be future complication, as I told you earlier. So it's better you cope or try to cope for us to give it to you because you've lost a lot of blood, which you need the transfusion as soon as possible. Is that okay, Mr. Christopher?
Yeah, that's fine. But one last question. What
Okay.
if my body rejects this blood?
Well, Mr. Christopher, there is no way uh, the body is going to reject it as your blood group suits this. So, Mr. Christopher, in case there is any complication during the procedure, you're going to stop quickly as possible. Is that fine with you?
Yeah, so you are able to handle emergencies in my case. That's what you say, right?
Yes.
Okay, fine. So I feel a little bit confident now, but get everything thoroughly checked, and afterwards only transfusion would be fine. So I agree on that, on those terms.
All right. So I want to go and prepare and come and start this procedure. Can
Okay,
I go
nurse.
on?
Yeah,
All right.
thank you very much.
All right. Thank you too.
Yeah. So very good. Now next one. Yeah. Right. Now let me give you the feedback. Richard Obeng
Yes.
from Ghana. Yeah, Richard. Yeah, now be silent and listen to me. And afterwards, I'll give you time to speak. So, fine. Richard Obeng, blood transfusion. Now, here you have talked very confidently, as if you're well versed with everything. The problem language is a barrier, but it's not that difficult a case for you. You are handling things very nicely, but there are some areas where you have to improve drastically, especially the pauses and breaks. There are pauses and breaks here and there, and you have to avoid these pauses and breaks, and you have to increase that with fluency and accuracy. So fluency means the way how I am speaking with the minimum pauses and breaks here and there. You can have pauses and breaks. It's not a continuity, but a fluency means where there needs a pause. In that case, come here. If there is a problem, sit and think how you can solve the problem. But do not rush, because you may end up in even serious and complicated situations. So wherever pauses are there, you have to place them, definitely. But the pauses should not be extended, right? Unnecessary sounds like like that. If it is needed, okay. If it is meaningful, okay. But unnecessary sound should be avoided. And you said there is no future complications. There is no future complications. When using complications, you will use is or are. That you have to know. There are no complications. But how can you say there is no complications? There are no complications. Complications is plural, so you have to use are and not is. So subject verb agreement is mismatched. They do not agree. There is no complication. There is no complication. Or plural. There are no complications. So complication is, complications are. Complication is, complications are. So is complication, are complications. There is a complication or there is no complication. There are complications or there are no complications. So remember that. Be careful when you are using verb before the noun, match them properly. After complications, you will definitely say are, but before it comes, you have to be very careful. That is your weak area. Then is that okay? How many times you told, is that okay? After every question, is that okay? One time you can say, how does that sound? One times you can say, is that okay? One times, is that clear? Hope you understood. Do you have any doubts? Alternate things. Now, in your speaking sessions, never again you use is that okay, because it became common. Try to avoid that one. Try to avoid that one. Is that okay? Try to use alternative measures. And don't repeat the same sentence time and again. Yeah, your voice, your style is very sweet. Okay, it is good to hear your way of speaking, but the drawbacks are also important. You cannot neglect them. You cannot ignore them. So next, Grishma is ready. Yeah, Grishma, next is your turn. So practice fluency. Practice without using the phrase, is that okay? Practice without pauses and breaks. How you can improve this? What you can do is take a newspaper or take a reading task. Take a reading task. Extract one or extract two where there are many paragraphs and read continuously without stopping. See, for example, the same card which is there. You are in hospital following a road accident. You are not seriously injured, but have lost blood and have been told that you need a blood transfusion. You have no idea what the procedure will involve. You're anxious about the procedure and the danger of receiving infected blood. You have read that patients have contracted HIV through blood transfusions. So you read like this. You read every day for 5 to 10 minutes. 10 minutes in the morning, 10 minutes in the evening, and if possible, 10 minutes in the afternoon. It doesn't take much. 10 minutes. Take a newspaper and read, or take a reading task and read. Here, when you're doing like this, it's a double benefit. You'll increase your fluency. and you will be exposed to how to read also. Reading also you are practicing here. Reading also practicing. Speaking also practicing simultaneously. Speaking you are practicing. Reading you are practicing. And fluency you will increase. So try to do this 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the. I know you are very obedient. That's why you got this admission. I don't give admission just like that. You're very obedient. So that's why you got this admission. I know you listen to me. So follow this suggestion, these suggestions. Follow this suggestion or follow these suggestions. These is plural, so suggestions. This suggestion. That's it. This is how you have to go. 1 second. Hello. Yes. Huh? Godrej. Yeah, please tell me. Lock installation. Two locks here. Door closer, not lock. Door closer. Hydraulic door closer. ఈ నెంబర్కి ఫోటో పెట్టాలనే ఓకే ఐ యామ్ ఇన్ ఏ క్లాస్ నౌ గివ్ మీ 5 minutes ఐ యామ్ ఇన్ ఏ క్లాస్ ఐ ఫినిష్ అండ్ ఐ సెండ్ ఓకే ఓకే సో now here it is. Now this is the way how you enhance your quality. Enhance your quality. And pronunciation. Your pronunciation is good. It's not excellent, but it's definitely good. If you want to improve your pronunciation also, what you can do is switch on your radio or switch on your audio or switch on your television. Don't look at the television if it is video. Just look some other side and just listen and repeat the words like how they are pronouncing. Try to imitate their pronunciation as similar as possible to that. We cannot be 100% accurate, but try to do your level best. Like small children, they learn rhymes. The teacher puts the audio and the students also repeat after the audio. Like that, you repeat after that. Take 3 or 4 words and repeat. Take 3 or 4 in the morning. In the morning. What do you do in the afternoon? In the afternoon, catch 3 words. In the afternoon. How are you? How are you? Where are you going? Are you going to the market? So you can catch any part. Are you going? And repeat. Are you going? Are you catch to the market? And repeat. To the market. Anything. 3, 4 words. Catch bits and pieces. There three, there three, there three. And try to repeat. And try to see that it is native accent. Britisher speaking, not some other person speaking. Britisher is the best. Because it's native. Okay, language. English comes from there. So it's better always. So now, I hope you understood. I have given you solid feedback. So this is enough for today. And now you can unmute Mr. Richard Obeng. Yeah,
All right.
and you can share your experience now in a few words. You have 1 to 2 minutes. Whatever you want to speak, you can speak now.
All right. First of all, I will say thank you for giving me this opportunity. I think switching off on my video boosted my confidence. That's the initial thing that I'm going to say, and I thank you as well. So I think we all have to keep on practicing, and you are here to always correct us, and it's good working with you and also with the class as well. So I think in general, uh, we are all good. We are all good as you are supporting us. I thank you for that.
Yeah. So now, yes, follow the same style. Don't hesitate When sir is giving speaking session, you can come relaxedly, come in good position, good posture, good dress, good style, good everything, and then come and attend. See, Christopher finished his speaking session, but still he is with you because sir will give some other feedback. This is a lecture, it's a continuous lecture going on. So it will be very excellent. Definitely it will be excellent. If you are exposing yourself to me to this difficult situation in the exam, it will be very easy. So follow the same style. That's better. Okay.
Right.
The same video sessions so that I can give you more and more. So if you limit, I'll limit. If you are unlimited, I am unlimited. That's all. So I will also get that finish. See, I'm coming on video, so I have to give more. So this will give me more advantage. For you also, it will be giving you more advantage. So what you can do is, if you feel that these sessions are very excellent, you can pass on my name. I have many students from Lesotho, many students from Nigeria. They know me very well. I am very famous in Lesotho and Nigeria. So I want to be famous in Ghana also. Ghana I have, but not equal like Nigeria and Lesotho. There are some 10 or 15 students I have taught from Ghana. So if you practice like this, definitely I'll get more students from Ghana. Is that clear? So you can
Mm.
pass on my name to your friends who are suffering like you. So they also can join our army. Okay?
All right.
Yeah, that's fine.
All right. Thank you.
Yeah. You can mute your audio and you can stop your video. So the next is Grishma. Grishma. Grishma is also a very obedient student. Yeah. Hello, Grishma. Unmute.
Yes, sir.
Yeah, Grishma. Now it is your turn. Are you comfortable with your audio or video, or audio and video both, or how you want? Because this is so how you have seen me. You have taken my audio sessions, and now you are. Have you taken my video session till now? No. So you don't know
No, sir.
what is the benefit of it. You will come face to face, exposure and everything. Now it is yours to decide. If you are, nobody is bothered about you. Nobody is bothered about you. It is your own progress. So you want to maximum 100% means you come on the video. So no problem. It's okay. I want to restrict. I don't want to go. Then you will get that fear. No, you cannot overcome that fear in the exam. So consider all these things and tell me, you want audio or video? Yes.
I will do both audio and video, sir.
That's awesome. You are a darling for me now because you are ready to give. I'm giving you 100%. You are ready to take 100%. That means you are a real darling. You don't have limitation. You are unlimited edition. Like Simon sir is unlimited. You are also unlimited edition. So you are going to get like Richard, and I'm going to make a team of fearless fighters. So you are in the team of fearless fighter, not afraid. Why should I? Oh, no hesitation. That's it. I really appreciate. I congratulate. You are in the team of fearless fighters, not second level hiding people and attacking. No, you are attacker now. So I congratulate you. So just give me 1 minute. Somebody is coming, so I have to send a photo. So immediately I will start. You have 1 minute to prepare. Okay, you have one
Okay, sir.
minute to prepare. Yeah.
Okay.
So which is the card you are going to do now? You sent me already, right? Yeah. This is a local health center. 80 years old. Mother's most recent 80 cholesterol. Okay, cholesterol. So it is cholesterol. Okay, fine. So get ready. I'm coming 1 second.